Hello everyone, I am Dr. Karthika from Department of Biomedical Engineering, SNS College of Technology, Coimbatore. In this April 2026 lecture series, we are going to discuss about indirect pressure measurement by Doppler ultrasound in measurement of pressure and blood flow. See why this topic is important. Here, our real world biomedical problem is cardiovascular disease and hypertension. Inaccurate blood pressure measurements it lead to improper diagnosis. The affected persons are patients, clinicians, as well as healthcare industry. The impact is misdiagnosis and delayed treatment, increased risk of stroke, heart attack, and kidney failure, higher healthcare costs, and reduced quality of life. So, we need to incorporate blood pressure measurement methods. See, the solution need for solution is limitations of our existing methods. Our existing methods, which involves manual systems, and these systems they don't have proper procedures, and they don't have ability for continuous monitoring, and they depends on operator, and as well as which leads to misdiagnosis. The clinical challenges, which involves difficulty in pediatric patients and challenges with obese patients, as well as peripheral vascular disease detection and variability in measurement sites. These are all the clinical challenges for clinicians as well as healthcare industry peoples. The technology gap is we need a non-invasive continuous monitoring system and automated data recording system, real-time accuracy improvement, as well as integration with healthcare information and technology. So, uh, so we need to modify our traditional methods. The new method we involve here is Doppler ultrasound, a continuous automated accurate solution method. See, introduction to Doppler ultrasound. Here, Doppler ultrasound means it uses high frequency sound waves to detect blood flow and velocity through blood vessels. The basic principle is transducer emits ultrasound waves. These waves are reflected off moving blood cells. Frequency shift, which is proportional to frequency shift del F, which is proportional to blood velocity. Here the Doppler equation, which involves del F, which is equal to 2 minus, which is del F, which is equal to 2 multiplied with F naught multiplied with V cos theta by C. The types of Doppler ultrasound, we have a continuous wave and pulsed wave. Continuous wave, no depth resolution. Pulsed wave, we have deep as well as selective resolution, which involves high accuracy, which is involved in high accuracy applications. See, the principle of indirect pressure measurement. It detects blood flow sound or velocity to determine the systolic and diastolic pressure through acoustic signals. Here, the working principle, which involves Doppler probe, it detects the cot of which detects uh, cork of sounds. Here the sounds which generated by arterial wall vibrations. Here the sound appearance which is equal to systolic pressure. Here the sound disappearance which is equal to diastolic pressure. That's it. Here the advantages, which includes non-invasive technique and suitable for obese patients as well as pediatric applications, accurate in low flow conditions. See the Doppler effect in blood pressure measurement. Frequency changes occurs when sound waves reflect off moving blood cells. The equation is del F, which is equal to 2 F naught V cos theta by C. Del F is your frequency shift, which is measured in hertz. V is blood velocity, and C is speed of sound in tissue. F naught is transmitted frequency. Theta is angle between the beam and flow. Applications in BB measurement. Frequency shift is proportional to blood velocity. Here the velocity detection through shift analysis, it determines systolic and diastolic pressure levels. See the system architecture. The main component involves transmitter, receiver, display system, ultrasound transducer, signal processing unit, and power supply. And the signal path, which involves oscillator, which generates signals, and further this signal is amplified which is sent back to transducer. This transducer converts your physiological signal into electric signals, which is used for patient monitoring system. See, the transmitter generates high frequency electrical signals. Transducers converts electrical signal into ultrasound. Receiver detects reflected signals from blood flow, and the processor which calculates frequency shift as well as velocity. See the working principle. The processing stage which involves preamp, filter, demodulator and FFT. See, the output is audio signal, spectral display as well as numerical values. The signal flow graph which involves input signal to preamp, bandpass filter, demodulator, FFT processor and then display. See, the clinical applications which is mainly used in blood pressure monitoring. And here we have our design thinking integration part, our empathy part, which involves the healthcare system needs and the problem statement, need for accurate non-invasive blood pressure measurement. And we have a solution, our ideate part, Doppler-based system, signal processing advances and automated measurement. See, here I've included student activity, group discussion and assessment questions, gate question. See the summary part. Here I have included principles, applications, system components and advantages of indirect pressure measurement by Doppler ultrasound. These are all the references for our topic. I think you'll get a clear understanding about indirect pressure measurement by Doppler ultrasound. Thank you.